Thank you for joining us tonight at the Allied Health Programs for College Preview Day. My name is Amanda Pangborn, and I'm going to start with just a couple of quick housekeeping items, and then we'll jump right into the main event, which are all these lovely people that have joined us from Allied Health. So for the presentation, which we're going to do now, if you could just, for anybody that's attending and not presenting, if you could just mute your microphones and turn your videos off just while the presentation is on. During that time, there is a chat function. Feel free to put any questions you may have into the chat. If I can't answer them through the presentation, then we'll do them live at the end. And also a link will be sent to you after June the 7th of this recording. So don't worry if you missed something, or, if say your friend can't attend, we will be sending out the link for the recording for this session. So without further ado, I'm not sure who is starting tonight.
I think that's me, Amanda.
Yeah.
Okay, well then that's Tiffany.
Yep.
Oh, okay, well we'll pass it over to you, Tiffany.
Okay, I'm gonna start sharing my screen, so you should be able to see. Oh, hold on 1 second here. I've got 2 monitors going on. Okay, can you see my screen right now?
I can.
Perfect. Okay, so I am the current coordinating instructor for the didactic portion of both medical laboratory assistant and medical laboratory technology. The voice you just heard was Vanessa Briand. She's taking over for me next year. So I'll introduce her at the very end, but I'll just go through these slides right now so you can see what we do. So you might have asked yourself, when you go to the hospital, if you've ever had your blood drawn, why do they collect so many tubes of blood from your vein? How does the doctor know what the best cancer treatment is for a family member? Maybe you've known somebody who is bruised really easily, or maybe you've had a doctor who has done some blood work and then has to adjust your medication, and you're not sure how they knew to do that. So those are all questions that we can answer in the lab from the different tests that we do. So I'll start with a little overview of Medical Laboratory Assistant. This is our shorter program. So it's an 8-month program, and it consists of 6 months of didactic courses, so courses that you would take at NBCC. And we are going to have a blended delivery this year of some online courses and hopefully some in-person class time as well, and some simulated labs here at the college. And then at the very end of all of that, you would do a 7-week clinical rotation at a hospital. I do have a little note here that you might have to travel or temporarily relocate. We do our best to place you at your home hospital, but we can't always guarantee that just because spaces are limited. So I always like people to know that up front. At the very end of the program, you write a national competency exam that's required for certification. So that's really important because in the province of New Brunswick, our hospital systems require you to pass that exam before you can go to work. So even if you graduate from NBCC and get your diploma, you still have to pass that exam that's administered by our national body in order to go work. Our courses take place mainly from Monday to Friday, 8:30 to 4:30, and we always tell students to kind of treat it like a full-time job. So what does an MLA do? So their key roles are collecting specimens from patients. So if you take this program, you will have to draw blood. Sometimes that means from inpatients in a hospital or from outpatients at a clinic, either inside or outside of the hospital. They prepare all of those specimens for testing. So you see an MLA here in the picture at a little centrifuge. So they would spin down the blood to separate the cells from the liquid portion of the blood. And then they would separate those different portions out to go off to do different testing. They're involved with like ordering up the tests and then processing the specimens and packing them to go to different hospitals. So they do a lot of what we call the pre-analytical work. So their areas of study are phlebotomy. So you do draw blood and you start practicing on students here at the school, and then you go out to clinical and you have to do 100 draws in a hospital setting to finish off that course. You'd study all of the pre-analytical processes for chemistry, for microbiology, for hematology, and for histology. And I'll talk more about those more in depth when we get to the technology portion. So next we'll go into the Medical Laboratory Technology program. So this one's a lot longer, it's 2.5 years, and you would spend the first 2 years in didactic courses and lab simulations on campus. And then at the very end of that program, there's a 4-month clinical rotation, which again, you might have to travel for just because we can't guarantee spots at your home hospital. And just like in the MLA program, there is a national competency exam at the end of the program administered by our national certification body that you do have to pass in order to work in the hospital systems in New Brunswick and in most provinces. Those courses typically run Monday to Friday, 8:30 to 4:30 as well. So it's a pretty rigorous course. All right, so their areas of study are really similar to the medical laboratory assistant program, but medical laboratory technology students go a lot deeper into each of the disciplines. So they also do phlebotomy, they also have to draw blood. They also study chemistry, microbiology, hematology, histology. They also do transfusion medicine and molecular genetics, which is unique to medical laboratory technology. The assistants don't do transfusion and they don't do, not as much transfusion, and they don't do molecular genetics. So the key roles of a technologist are to understand the principles and perform all of the analytical techniques on all kinds of specimens. So if you've ever had like a swab done, or if you've ever had blood drawn, or if you've ever had tissues or an organ removed from like a surgery, chances are it's gone to the lab and had something done to it. So we test every single specimen that could possibly come from the human body. We also troubleshoot and fix issues with automated instruments. So we're kind of like mechanics. Anytime something breaks in the lab, we're kind of responsible for fixing it. And we also have to report valid test results to physicians in a timely manner. So that involves a lot of quality control, a lot of double checking, a lot of statistical analysis. So things like chemistry and math and statistical awareness are really important in this program. All right, so what do the courses and the labs look like? This is the stuff that you guys really want to know. So I'll talk about this sort of from a medical laboratory technology perspective, but keep in mind if you're applying to the MLA program, you would do a lot of the prep work for all of these tests. So we'll start with clinical chemistry. I have a note here that basic lab math is required as well as basic chemistry knowledge. So if you're coming into this program and you struggle with math or you struggle with chemistry for either MLA or MLT, it's really important that you brush up on that through the summer. So some students in the past have gotten tutors or they've done upgrading courses or whatever it may be. I will have an email address available at the end of the slideshow if you want to reach out to get some more information about how to get help, you can do that. But I always put that disclaimer up there because that's usually where our students run into trouble is with math and chemistry. So we have a lot of automation available in chemistry due to high volume of specimens. And when I say high volume, I mean thousands of tests per day get run at the St. John Regional Hospital, thousands of tests get run in Moncton, and thousands of tests get run in Fredericton. So we rely on instruments like you see here at the bottom of this slide that do a lot of that work for us. But when I say that, there's still a lot of troubleshooting and that sort of thing involved with the instrumentation. So those tests include things like glucose, electrolytes, a lot of those basic chemistry tests that you've probably heard about on like Grey's Anatomy. There are still some manual methods required for some tests. So we still look at urine manually, we still do pregnancy tests manually, along with some other things. So next is hematology, which is kind of my baby. I spent a lot of time working in hematology. And there are two major sections there. So there's one part where we do blood cell counts. So we would count all of the white blood cells and classify them. So like you see on the picture here, I would identify each of those cells. So some of them would be metamyelocytes, some of them would be segmented neutrophils. And the number of each kind can tell the doctor all kinds of information. We also look at the red blood cells. And then the other big section is coagulation or hemostasis. So that has to do with bleeding and clotting. So we would look at diseases like hemophilia in there. So in hematology, we can help diagnose patients that have anemias, which means low iron, leukemias, even malaria, which you might think is not that common in New Brunswick, but because people pre-COVID traveled a lot, we would actually see a lot of malaria cases come through St. John. So that's something that was really interesting. And things like infectious mono. Then we have microbiology, which is a huge part of medical laboratory technology. And you've probably heard a lot about it. Every COVID test that gets put out is done in microbiology. So they have a huge increase in workload this year. So their job is to recognize which bacteria is normal and which is harmful to the human body. So they get to grow that bacteria from all kinds of sources all over the body. So again, from like tissues, from swabs, from body fluids, from all different sample types. And then they run some tests to determine which antibiotics can best be used to treat them. So not only do they identify the bacteria, but they can also tell the physician what's going to kill it. So it's a big puzzle. It has lots of investigative work. It's a lot more detailed than just growing bugs on a little plate. There's all kinds of biochemicals and test tubes and big instrumentation that help you narrow down what those bacteria might be. Next comes histology. So I find that a lot of people who are really artsy like histo because it's a lot of staining tissues. So in this lab, they take big pieces of tissues or organs that come up from like the operating room or from clinics, and they record the gross description first, so what it actually looks like as a whole piece, and then they cut it up into little tiny pieces and put it into wax blocks. And then they take those little wax blocks and they cut them or they shave them into really thin ribbons that they put on a glass slide, and then they can stain them. So you get things like this picture at the top that looks like a bunch of flowers. That's actually from a large bowel. So even gross things can look really pretty in histology. And there's a little note here at the bottom that in New Brunswick, anything that's surgically removed from the body is sent to the lab for processing. So even like if you get teeth removed at the dentist, if you don't take them home with you, they come to the lab and we see your teeth in the lab. So literally everything that comes from the body goes through histo. And then next we have transfusion medicine. So this one's really fast paced, or it can be really fast paced, depending on what's going on. So anytime there's like a gunshot victim or a stabbing or a car crash or like even a cancer patient can take a lot of blood, transfusion gets really busy. So they have to determine the blood type, and this goes way beyond the A, B, and O that you've probably heard about on TV shows. There are dozens and dozens and dozens of blood types, and they have to work out exactly what it all is. And then they have to test, and the test is called a cross-match, units of donor blood from Canadian Blood Services to see if they're safe to give to our patients. And then they also have to prepare other blood products like plasma and albumin and clotting factors and platelets. So there's a lot that goes on in transfusion. And sometimes on night shifts, I would see them running up and down the stairs to the emergency room, delivering blood products, running back up to get more, running back downstairs. So when I say fast-paced, I mean like they're literally sometimes running back and forth to get the blood to the patients. So if you're thinking about becoming a lab professional, and I'm assuming some of you are, the student skills that are required are time management. It's an extremely rigorous program. We move at a really fast pace, so you have to be able to manage your time effectively. You have to be really organized. Again, it's a really fast-paced program. Attendance management is really important. You have to be here for all of the labs because we cover something different each day and you have to see all of it in order to be successful. It's important that you have strong communication, like I said, an understanding of basic math and chemistry, and that you're able to follow instructions and procedures. On the job, a lot of the skills are very similar. So again, strong communication, really good teamwork because you're processing so many samples in such a high-paced environment. Critical thinking, confidentiality, and the ability to work shift work because labs do operate 24/7. So some locations that you could work at in New Brunswick are hospitals. They are our main employer, so either at Horizon or Vitalité. Canadian Blood Services, private clinics, even some vet clinics will hire lab techs. You can work in research, manufacturing, you can come back and teach. There's all kinds of jobs available. And just an idea of salary ranges in the province of New Brunswick, MedLab assistants make somewhere between $20 and $22 an hour, and MedLab technologists start at around 27 and they can top out at around $36 an hour. That can increase if you go into supervisory roles or management roles. That's just for a general bench technologist. So if you'd like to know more, you can go to the NBCC website. We have a page there that describes both the MLA and the MLT programs. We do have a provincial regulator. It's the New Brunswick Society of Med Lab Techs, so the website is listed there. And our national body that's responsible for administering the national exam is the Canadian Society for Medical Laboratory Science, and their website is listed there. And you can also contact a laboratory instructor. So next year, Vanessa, if you want to turn your camera on as well, that will be Vanessa Breon. So she'll just wave hi here. And that is her email address there if you would like any additional information about the programs. And I'll turn it back over to Amanda.
Thank you very much. Who is presenting next? What program would like to go next?
This is Melissa. I don't mind going next.
Okay, great. I'll just remind everybody that if you're not presenting, to mute your chat and turn off your camera just for the bandwidth. So thank you. Thank you, Melissa.
All right. I didn't share my screen yet. I don't think, did I? All right. I'm getting there. Perfect. Okay, thank you, everyone. You can see my screen? So yes, the program that I'm presenting tonight is the program that I teach in, which makes sense. It's the Pharmacy Technician program. It's a 2-year diploma program. We don't have a start for this at the Moncton campus this year, but St. John does have a September start. So I'm hoping that there's a few students online that are going to be starting in September. So our program is a 2-year program. At the end of the 2-year program, you do receive a diploma. And after the diploma, you will be required to write national exams as well as provincial exams. Upon entry into the program, you will register with the New Brunswick College of Pharmacists. We are a regulated profession, so you'll be registered with the College of Pharmacists and adhere to all of their policies, just as if you were already graduated and working as a healthcare professional. So in the corner here is a picture of our lab and just a little snapshot of our lab. So we have tons and tons of bottles, of prescription bottles. And the funny thing is there isn't one medication in all of those bottles. So we have items that are called mock meds. So they're fake meds. They do the same thing. They don't do anything to you, but they do the same thing as far as learning how to count, learning how to handle them, learning how to verify that it's the correct product. So it's kind of an interesting thing that we have this lab full of things that look pharmaceutical, but have none really in it. So that's that one. Next up, what do we do? So pharmacy technicians are responsible for all of the technical aspects of pharmacy practice. So when we think of technical aspects, we're looking at technical verification. So when a prescription is filled, the technician is going to make sure that the patient is getting the right medication, the right quantity, the right strength, the right drug, that it's still in date, not expired, and all of the other technical aspects, making sure that the product is indeed looks great, that the tablets aren't crushed or anything like that. So that's technical verification. Another scope of practice that we have is our device demonstrations. Technicians are able to teach patients how to use any device that's involved with their medications. So for example, an inhaler for somebody with asthma, or a spacer. So I don't know if any of you have seen a spacer, know anybody with asthma, but a spacer is a device that's, that helps the patient to breathe in the medication better. Blood pressure monitors, diabetic tools, and many more. So device demonstration is another scope of practice that we have. We have a really exciting new scope of practice. I should have put little stars and flashing lights by injections. So we just got approved that our scope of practice now includes the technical aspects of giving injections, which means that we can give an injection to a patient, so an IM or an SC injection, so an intramuscular or a subcutaneous injection. So that's separate training that you will need to complete, but by completing our program, you will be able to complete that training so that you can become certified to give injections. I'm very excited for that scope of practice. Now, one thing about COVID is it really has opened up the need for everybody in healthcare to be used to their full scope of practice, and that's what's happened with this. We are definitely capable of giving injections, and now they're letting us do that. And when I refer to the technical aspect of injections, that's because there is a clinical side to it as well. So whenever we talk about medications, there's always the clinical side of how medications work on the patient's body. That isn't within our scope of practice, that's the pharmacist. So the pharmacist would talk with the patients about the injections, any interactions, and all of that kind of stuff, and then we would give the injections. It's supporting the practice of pharmacy in a big way. Next, supporting the pharmacy team and patients. So we are there to support the pharmacy team. In a pharmacy, you'll have pharmacists, pharmacy technicians, and pharmacy assistants. And so the pharmacy technicians work to support the entire team, whether it's answering phones, getting a patient at the counter, or delivering meds to a nursing unit. We're involved in all of those practices of pharmacy. And we're also involved in aseptic training. So a really, really cool thing about pharmacy technicians in New Brunswick, every single dose of IV chemotherapy has been prepared and checked by a pharmacy technician. So if you know anybody that's received IV chemotherapy, they've received a dose that was prepared by a pharmacy technician. The picture to the left shows laminar airflow hoods. So there's two that are the same, and then one in the very corner that's a little bit different. So you will receive 135 hours of aseptic training. So you are really good at it by the time you get out there. And this is just our aseptic picture of our aseptic lab. This is one of the really fun labs. Not so fun if you're nervous with needles, but trust me, you get over that quite quickly. Next, where can you work? So in this picture, I have a screenshot of the hospital, just a screenshot of part of the pharmacy in the hospital. And so you can work in a hospital setting, in a community pharmacy setting. Community pharmacy settings are, an example is Shoppers Drug Mart, Jean Coutu, Family Prix, you name it, Guardian, all of the rest. So that would be a community pharmacy. Government agencies such as federal government, provincial government, and also, so that would be involved in dispensing of medications, or in the other aspect of looking at products and figuring out if products should be covered or be on the formulary for the province of New Brunswick, and those types of things. So our pharmacy technicians are kind of everywhere, as well as private companies. We have a number of graduates that are working for Blue Cross and for other companies similar to Blue Cross, so third-party billing. We are really good at understanding medications, which helps that process of billing and deciding if medications are covered and all of those processes. What's important to know? As you're coming into the program, math is really, really important. So what level of math? I am not looking at calculus. If you're great at calculus, that's wonderful. But the math that we're looking at in pharmacy, it starts very, very basic. We look at fractions. We look at conversions from milligrams to grams, and then we advance into IV therapy calculations. So we start small and we go back to probably grade 5 math for a lot of us, and then we work our way up to become very advanced. But math, having a strong base in math is very important. Communication is key, I guess, for all the healthcare programs, because you are working interprofessionally with a number of other healthcare professionals as well as patients and clients. So there will never be a time when you do not communicate with somebody during your day. English is really important as well, because we need to be able to present ourselves well, whether we're doing device demonstration or whether we're writing a report that needs to be presented to somebody. And ethics, I put ethics because ethics is really, really critical in our job and understanding ethical principles. So that's something, of course, you don't need to have courses in it. We have lots in our program, but it's something just to think about. And that's all I got for you. Any questions or we're not doing questions till the end, is that right?
Yeah, that's right. But just to let everybody know, you can still type your questions into the chat, or feel free to wait until the end, and we can certainly do them live. We just have respiratory therapy left, and practical nurse and personal support worker. So, and then we can go right into the questions. So who would like to go next?
RT here.
Okay, great.
I'm Christy. I'm the I'm the coordinating instructor for the didactic side of the respiratory therapy program, and my colleague Sean McCarville is here as well. And Sean, you are?
I'm the clinical coordinating instructor for the RT program. Even though Christy just tried to claim it, I will hold on to it for a little while.
So we'll run through a little presentation, and then if there's any questions afterwards, please let us know. So I will share my screen. Does that look good? Can you see that there, Sean?
Yep.
Perfect. Oh, this is all different. Okay, so respiratory therapy. So we will start off by showing you guys just a little bit, a little view inside of our medical simulation lab. So here at NBCC, our program is a combination of time spent in the classroom, time spent in high fidelity simulation, and then time spent in the clinical world. So we have some students here with our mannequin, learning their skills, looking very intense. So respiratory therapy is an allied health discipline. We assist in the diagnosis, treatment, and management of patients with cardiopulmonary disorders. So if it has anything to do with the heart and the lungs, we're involved in it. We function in a variety of settings, including the hospital, in research, community, and private industry. And really our role has just been expanding over the last few years. So we're sort of an up-and-coming profession in that kind of field. So back in to our sim lab again, as you can see, when you look at this sort of picture here, we have our simulation lab set up to look like really an intensive care unit. So this is what a bedside might look like in an intensive care unit. So we can simulate with our mannequin and our ventilator over there in the corner. If you can see the breathing machine there, and monitors up on the shelf there. So we can simulate what it's like and put people into what it's like in a real life ICU. Sorry, I think the PowerPoint's on slideshow presentation, so I apologize. Try to do this quickly. So the program itself is a 3-year diploma program here with NBCC. There's also a route that's a 5-year degree program through UMBSJ and NBCC. I'm unaware if anybody here tonight is from the BHS program or not, but we do accept students through both the University of New Brunswick and the community college. Your training will consist of time spent online in the classroom and in labs with medical simulation and clinical exposure. So like MedLab had said previously, we sort of run this kind of blended delivery right now where we're doing some of our coursework virtually, and then some of the coursework will be done hopefully a bit more in the classroom this year, and all of our labs are done in person. So our simulation, our medical simulation, that's all done here in our labs, here at the Allied Health building at NBCC. So here's another picture in our lab of somebody who's intubating. So they're putting a breathing tube in. One of our intubation heads, one of our mannequins, with some assistance here from one of our students. So if, you know, there's been a lot of talk lately of COVID and ventilators and intubation and people in the ICU, and that's really what our respiratory therapists are there at the forefront of all of that. So if you look at the program itself, we are technically a Monday to Friday, 8:30 to 6:30 kind of gig, but with COVID and with the virtual delivery, we've sort of moved back, and things have become just a little bit more flexible for us and for you guys. Your first year, September to June, will be online in the classroom and lab time. There'll be an orientation in September for all of our first year students. And there's a week of observational clinical in the spring term of your first year. We just completed that with our first year students this year, and it went over so well. I'm so excited for any of you who are in the program to do that this year. In your second year, you've got 29 weeks of classroom time. And then once the middle of April hits, you enter into clinical and you begin your clinical time with us. And clinical will last those last 10 weeks of the school year and the entirety 30 weeks of your third year. So you'll finish again somewhere in around April, mid-April, end of April of your third year. And at that time, you are eligible to write a registered exam, so a national exam for credentialing, national licensing exam, to become a registered respiratory therapist. And you can complete your time with us and start working. There is one important thing to note, that before you come to us, you should be sure to complete a physical, a vaccination, and your criminal record check, all hopefully before September, but definitely entirely before you enter into our clinical time, which again begins in your first year of the program. So you will need all of this stuff done before we enter into clinical and we go into the hospital for the first year of the program. So this is a picture of some of our students who are taking arterial blood gases. So part of the job is to draw samples from the radial artery and some other arteries, but most commonly the radial artery, to assess patients' oxygenation and carbon dioxide levels. So that's a task that we perform as respiratory therapists. Sean?
So Christy has mentioned that we have involvement with everything to do with cardiopulmonary diagnosing and treatment, and some of the areas that we're going to study would include like general anatomy and physiology, and then we would do a separate course on just respiratory anatomy and physiology. We would cover off things like pharmacology, professionalism, so how do we work with other disciplines. Of course, we're going to cover off medical terminology so we can understand the lingo and the words that are being said around us. Pathophysiology, so we focus heavily on respiratory pathophysiology, but we also will talk about different cardiac pathophysiologies as well as just general pathophysiologies that would affect somebody's ability to breathe. We have a course just on anesthesia, so there's a potential area of practice for respiratory therapists is in the operating room, helping the anesthesiologists perform their job. We'll have courses on different equipment that we would utilize, in addition to 2 courses on mechanical ventilation. And we talk about what mechanical ventilation is, how it's done, and the effects it has on the body. Of course, we'll have some courses on patient assessment. We actually are one of the only disciplines that when you graduate, upon graduation of our program, you would be able to work in not only adult intensive care, but also neonatal and pediatric intensive care immediately following graduation. So you have some courses in those. It's important to stay current when you're in healthcare. So we have courses on research. And another bonus that the NBCC program offers to you is that you'll graduate with 3 additional advanced life-saving courses. Those are advanced cardiac life support, pediatric advanced life support, and neonatal resuscitation program. So again, you could work in absolutely any area of care. So this is another image of our sim lab where Christy had showed you earlier. Our students were learning on the adult simulation mannequin. We also have the ability to use a what we call sim baby, and this baby actually breathes, and our students are going through an exercise in resuscitating that baby right there so that we can learn in a nice, safe, controlled environment. So how are you assessed? It's a pretty important aspect of your learning. We use a variety of different methods and tools, a lot of multiple choice quizzes and tests and exams, short answer essays and practicums. The big part is you will have 3 comprehensive exams that begin in the beginning of or at the end of your second year, beginning of your clinical time with us, and they would carry on through your entire clinical year. And we would do exams that last anywhere between 2 hours to 4.5 hours on every single subject you've ever studied. So those are pretty intense days for our students. Once you're finished with us, you of course would be eligible to write our national registry exam, which is called the CBRC exam. It's usually written in July, the first week of July and the first week of January. So you would finish our program mid-April. You could begin working as a graduate respiratory therapist, and then in July you would be eligible to write your registry exam. Here we're doing an interdisciplinary education event where we actually have students teaching other students. And it's an important aspect of our respiratory therapy program because we do work in an interdisciplinary team. And by learning together, we actually learn how to work together better. So we're actually having a couple of our senior students here demonstrate to some medical students how to manually resuscitate a patient. So your program structure, your first term in the fall is what you see on your screen now. It looks pretty heavy, but if you notice over to the right, it talks about first 7 and second 7. So not all of these courses would be running at the exact same time. For instance, Healthcare in Canada, Robertson Institute or Orientation to Service Learning and Work Safely happen in the first 7 weeks of that term. You'd have a Student Success Week, which is a week break, where you would have access to instructors to get caught up on things. And then you would have a second 7. And the second 7 would be things like interpersonal communications and ethics. However, you'll note that the bottom 3 courses are running the full 15 weeks, or sorry, 4 courses are running the full 15 weeks. So it is a pretty jam-packed term where you have some starting and some ending and some just continuing on. So you could be writing midterms at the same time as writing final exams. Your winter and spring terms in year 1 is really where we dive into the fundamentals of respiratory therapy. You'll see that we have fundamentals of pharmacology, and that pharmacology is like respiratory pharmacology. That's a 90-hour course on just medications that affect our lungs. Foundations of pathophysiology is more like cardiac pathophysiology, where we're understanding different things that are happening in the heart. Applications of respiratory equipment and therapy. So we're learning about some of our equipment. Pulmonary diagnostics, you're learning about breathing tests and seeing how lungs work, and blood gas theory and clinical practice. That's the image that Christy showed earlier, where we're talking about taking blood from people's radial artery. And it's a really neat opportunity here at Allied Health, where we actually partner with MedLab and we actually analyze those samples. So it's actually a pretty neat exercise. Term 3 is Introduction to Clinical Respiratory Therapy, and that's our observation clinical week, where we get to go out and we observe our preceptors functioning and working. Back and form ECGs. In some centers, RTs are actually administering ECGs. And then we also have, cardiovascular. I'm getting my pathos mixed up a little bit, I think. So this is your cardiovascular patho in term 3, not in term 2. We have a lot of patho courses. So we'll skip to the next slide. In the fall, this gets to be a really intense term where you start to learn about dealing with the babies and the neonates and children. We really dive into respiratory pathophysiology and all of the bread and butter diseases that we're going to work with on a daily basis. You're going to look at some advanced procedures that we're able to do. We also have courses on just how, not just what's wrong with the heart, but how does the heart work? So hemodynamics and the movement of the blood through the heart and the electrical impulses through the heart. And then we also have respiratory mechanical ventilation 1. In term 2 of the winter year of your second year, you're going to do some more research and whatever else it said there. So anesthesia, neopeds 2, and McVent 2 are some more courses that you'll take. And then in the spring of year 2, this is actually when we're going to start you in clinical, and you'll spend the rest of your time with us in clinical. And the neat thing about respiratory therapy program is we actually expose you to shift work right away. You'll start doing nights and weekends right out of the gate so that you can get used to that, exposed to that type of work. And let's be honest, if anything's going to go bad, it's going to go bad on nights. So you're going to get to see that. So some of the courses we cover off in your last year are just our prep for clinical week, our anesthesia rotation, general therapeutics, neonatal, adult intensive care, pulmonary diagnostics. So you get exposed to all of those things. And then of course we have things like professional development and prep for national credentialing and introduction to entrepreneurship, because our scope as it expands, we're actually able to open our own businesses now. And they say hang a shingle, where you can actually just start your own business. So we introduce you to that concept as well. And then we teach you how to be a preceptor, so that when you finish schooling with us, you'll be able to teach the next group of students that are coming up behind you. This is just an image of our students taking part in that service learning day, which we call the Robertson Institute, and they were doing a beach cleanup, because it's important to know that even though it's a jam-packed year and there's a lot of things that can cause stress, we try to have as much fun as possible, and you could tell that these guys were having a great time on the beach. And there's some information on how to get a hold of us. If you wanted to get a hold of either Christy or myself, please feel free to drop us an email. I probably wouldn't necessarily try those phone numbers all that much because we don't check them very often.
Thanks, Sean.
I was trying to keep up with your pace.
Yeah, the slideshow was on like automatic slideshow and I didn't know how to turn it off.
It's all good. We got through her.
Thank you very much. It appears that there seems to be a bit of a malfunction with the chat. So our attendees they seem to be having some issues. I think the access is restricted. Mike tried to look into it, but we're not sure what's happening. So at this time, anybody who has joined us, any of our guests, if you would like to unmute your microphones and ask live questions, please feel free if you're having a hard time with the chat function. And as we're sitting here, all of the emails for your instructors for the different programs are being typed into the chat. So feel free to go and take a screenshot of that, or just go scroll through and jot those down if you have questions, keeping in mind that our instructors work until about the 25th of June, and then they are off for the summer, and then you'll be able to, of course, you'll see them in the fall.
I'm just going through now and allowing the microphone for all the guests. So if you tried earlier and you weren't able to unmute, you can try again if you'd like, because their microphones were disabled from our side.
Okay.
So I just enabled all of those. So if anybody wanted to try.
If any of our guests would like to shout out some questions, we still have some time to answer. And in the meantime, while we're waiting, I do know that some of our most common questions, I was just as we're waiting, would be one of the biggest questions I hear are about the placements, like the clinical placements. And students are often wondering if they have to find their own, or if it's something that you do with your instructors within the department. So
I'll talk about the RT program's placements. So we do a pretty extensive time in clinical. It's about roughly 14 months, 12 months-ish, and you will be asked to travel during that. And before we place you anywhere, we do a survey and try to get your preferences for where you have accommodations. But we secure your placements once we find out where, or try to find out and accommodate those places that you have accommodations that already exist. And we try to place you where that would be financially feasible and reasonable for you to get your exposures, but we'll definitely talk about that once you get into your second year.
I have a question that just popped into the chat about, can a student do their work term out of province?
So again, I'm kind of hogging the line here for Melissa and Tiffany, but and Christy, I guess. But for respiratory therapy, we have some agreements with certain provinces, and it just depends on, of course, our COVID response level, and if our borders are open. And if our borders are open and you're able to travel to that province, and we have a current understanding with them, then they would be able to do that.
There's another question that's come in about for MLT. Could a student set up an out of province MLT exam?
Yeah, so those exams are administered Canada-wide, and this year they actually moved to remote proctored testing as well. So you can do them from home as long as you have like a stable Wi-Fi connection. You need a webcam, a microphone. They have a list of requirements on the CSMLS website if you're interested in seeing what they require, but you can do it from home through remote proctoring if you would like to do it that way.
Great. Don't see any other questions that are coming in right now. What about, I do have another common question. What would happen if a student wasn't successful in a course? How does that work because we're very structured our course delivery? So if a student isn't successful in a course, how do they go about retaking it and carrying on with the program?
I think I can speak to that. So at NBCC, we do have a supplemental examination policy where if somebody does not pass the course, but they come within 10% of the pass mark, they are able to write a supplementary. And there are various parts to that policy that would really define whether or not you qualify. One of the things that you would have to do is complete all of your coursework in order to qualify for a supplemental. But there are many post-secondary institutions that don't have supplemental exams, so that is something that we do have, and you can write 2 supplemental exams per term. But if you do not pass in the end, there's a few different mechanisms depending on the course. You may be able to do that course completely online through our professional and part-time learning and stay on graduation track. Some of our courses, though, that are more technical, that are more related to the profession, may be harder to get. And that may mean that you have to come back to the program the next year. And what happens when you do kind of fall off of your original graduation track is if you come back into the program, you're not guaranteed a clinical seat anymore. And that said, we do usually find a spot for someone, but there's always a chance that you would not have that that space in a site. So it's just one of the things that happens, unfortunately, when somebody falls off grad track. Remaining on grad track would guarantee that you would have all of the clinical placement sites that you would require. So the amount of time that you see on the website for completion of your program is really the minimum amount of time that you would take to complete that program. Everybody hopes to be able to complete it in that amount of time, and the programs are designed around that. However, there are backup plans, and we do a lot of personalized plans for various students.
Thanks, Tammy. We are getting some questions about the delivery this year. That can be found online as it's updated. Students are questioning, how much time are they going to be in class versus online? It's certainly the question of the hour most days. That can be found at www.nbcc.ca, and right on the homepage it says attending NBCC, what to expect. I will put that link in the chat. And that is updated frequently. However, if there are any of the instructors here maybe want to, if you could talk a little bit to that, it probably would be helpful to the students.
Yeah, I'll jump in about med lab. So I think all of our programs are aiming for between 40 and 80% in person this year. For med lab, we'll probably fall somewhere in the middle of that just by virtue of all of our labs need to be on campus. And since we are a laboratory-based program, we do spend a lot of time in the lab. So if you're looking at either med lab assistant or med lab technology, I would say there's probably going to be an average of about 50 to 60% in-person delivery next year.
It's about the same probably for respiratory therapy as well. We're aiming to have a little bit more on campus, especially for those who would like that. Some people do like still the option to be at home, so we're going to try our best to sort of blend those for everybody. But yeah, so we are like med lab, we are looking to increase our time in the building, somewhere in that, again, 40 to 80% range. We're probably hovering around 60 to 70, I would say.
Agreed. For Pharm Tech, it's the same thing. We're going to try our best to have students on campus as much as possible. You know what? It was really surprising and really nice for us instructors to discover is that students want to be in the class. So we're happy that you want to be in the building with us, and it really does add to your learning, but also to our delivery. And being able to see students is really nice. So we're going to do our best to get you there as much as possible.
Thank you. So we are down to the last 5 minutes or so. We don't have any other questions that have come in, but for everybody out there, we do have a few minutes left. So please feel free to either type in or shout out any of your last minute questions. And I do have one more quick question that is common to us is books. When can students expect to get like a book list? Because a lot of students don't want to wait till September and they want to know if they can get them early. So I'm not sure if that's possible for every program or not.
Yeah, I know that the dean has approved the fall book list, and all the coordinators have looked through the fall book list. So I would say that that communication should be coming out fairly soon. And during the first week of school, we do give students the opportunity to go and pick up their books physically at Grandview Avenue. But you can pick up your books. In the summertime. Typically, picking up the books is in August, and the bookstore manager, her name is Brianna Boyd, and she takes emails for questions about books. And as soon as the books come in, she can reach back out to you if you'd like. So just reaching out to Brianna about the book list, she'll be able to let you know exactly when your books land. And if you don't get that opportunity over August, when you're in school that first week, we will give you some time to drive to our Grandview Avenue site on 950 Grandview Avenue so you can pick up your books. But if you think about med lab, respiratory therapy, and pharmacy, they are all located at the Allied Health Education Center, and specifically the pharmacy that begins in September is at the Allied Health Education Center, and that's on 100 Tucker Park in St. John. So it's really the UNBSJ grounds across from the St. John Regional Hospital. So you want to make sure that you don't make the mistake and think that your classes are at Grandview Avenue, because you will be based out of the Allied Health Education Center at 100 Tucker Park. The Moncton program is at the Moncton campus of NBCC, and it doesn't have a September start this year, as Melissa indicated earlier.
And one quick question about the parking. How do students go about getting their parking passes? Because students attending Grandview Avenue have parking is free, but I know there is UNB students attending Allied Health do have to pay a parking fee. So how do they go about obtaining a parking pass?
So when you first come onto campus, the security guards are not ticketing for that first week or two, and that's because they anticipate that students are first getting there and they're first finding where to park and that sort of thing. So during that first time, we're going to encourage you to go over to Grandview Avenue to have your photos taken. And so that photo is a picture ID that you can use for various things, including when you purchase your parking at UMBSJ. So you would come back after having your photo taken and you would go into one of the offices, the office of the registrar on the UNBSJ campus, and you would buy your parking pass. Those, at this point in time anyway, they are selling parking passes by appointment only, and that's quite nice. You just get an appointment and go on in, so there's not much wait at all. So yeah, that's how it goes.
Great, thanks. Okay, folks, well, we are just about at the end. Does anybody have anything to add just before we say goodnight?
We're excited to see some of you in fall.
You've chosen good programs. They're really exciting, and healthcare is at the, precipice of the world right now. Everyone's looking at healthcare, so you've chosen good programs to join.
Absolutely.
There's definitely no lack of job prospects in any of these programs. I will say that it's a bit of a I don't want to use the word crisis, but there's a lot of job opportunities there for everybody.
Definitely.
They've actually hired our first and second year students for the summer this year, so you guys will definitely have jobs.
Mm-hmm. Thank you guys for all taking the time to come on and meet us, and we appreciate it.
Great, thank you.
Take care, everyone.
On behalf of the entire NBCC community, I would like to thank everybody for joining us tonight, and we're super excited that you're joining our NBCC family, and we can't wait to see you in the fall. Good night.
Bye-bye.